Welcome back to the channel. I'm Andrew with Running with Dr. Andrew. It's another episode of Common Injuries. Let's talk about chronic ankle instability. Let's go. Hey, welcome. I'd like to share with you some tips on how to help with your chronic ankle instability. And so what happens is whenever you have a something called chronic ankle instability, you've had probably multiple injuries to your ankle where you rolled your ankle multiple times and injured all these ligaments that are down through here. And then also there's a ligament here called the syndesmosis right through here between this bone called the fibula and this bone called the tibia. And there's a ligament here that attaches right here, so whenever you injure all these, this gets injured too, so kind of more of a high ankle injury. And that causes instability in your ankle multiple directions, in this direction as well as up and down, side to side. And then what happens is whenever you step down your foot, and then whenever it splays out more, so you end up pronating even more. Pronating meaning that foot rotates in more. If you can kind of see this here, this is pronation going in this way. And so what happens is, so you normally pronate, so you're walking and here, and when you step down here, you pronate. And so the problem is whenever you push off, you continue to pronate, and then your knee, if you can see my knee down here, goes in even more this way. And that's because structurally you may have some issues with this syndesmosis ligament as well as along the ligaments here. So what happens is you become unstable up and down in this direction and side to side. And so neurologically what happens is when we have issues down below, we call it distally, meaning down away from your body, you'll have issues proximally above the area into your hip. And so when you stand, because of that syndesmosis, you'll actually have one hip that dips down more a little bit because the glute muscles are not activating properly. The glute muscle called the gluteus medius is a very important muscle, so that muscle is kind of shut down just a little bit, and then that creates some issues with your running gait, and you're not pushing off very well, or even just your walking gait as well too. And I typically will see this with every patient that I check with this, with the hip down. They will have a chronic instability issue on one side or other. So I would say about 95% of the patients that I check with this, and when I'm suspecting they may have a chronic instability there. So again, functionally that can cause some issues there up the chain. So I'm going to show you a few ways to help improve that stability there. So one way you can do is you can do something called, if you got some kinesio tape. And so I found what happens is when you give some stability around your ankle, and some sort of input, neurologically, you'll actually have better activation on your hip. And so again, what happens is whenever you have the chronic instability, it'll decrease your single leg stance, meaning you will have difficulty standing on one leg. And that's very important for running, because if you're not standing on the one leg without running, and then obviously you're not being able to push off very well with your leg, and that's very important to do that. And so one way to do that, to give yourself some input, is doing some sort of stability around the ankle. And so how you can do that, you can get some kinesio tape. This is some strip of tape here. You can get this at Walgreens, Walmart, or any type of drugstore or sporting goods store should have this type of tape. And some of them are kind of pre-cut. This one's pre-cut, so you just pull it out from the roll and then tear it. In fact, I got the roll right here. You can kind of see this right here. So it just tears into individual pieces there. So this is really good stuff to help out whenever you have ankle issues. Sometimes some people put it on their shoulder. And so for this video, we're going to do purposely for how to tape that ankle there. And you don't have to necessarily have to put a lot of pressure on it. And so what you're going to do is you can tape it here and then come around your ankle. So it's going to be above this ankle joint here. Again, when I find what happens is whenever you give yourself a little bit of input there, actually patients will have better single leg stance. They'll activate their hips better, and mechanically and everything. Now there's definitely some other things that you'll still have to do to help improve that. That's just one way to kind of get you activating better with your ankle instability there. So next thing you can do is do some strengthening exercises. And so what you're going to do is grab a band. And so you probably might have seen me do this before. This is going to be strengthening a muscle called the posterior tibialis. That's a muscle that's underneath your shin. It comes around and attaches here and helps support your arch better. So it's going to be definitely a very important muscle to strengthen, is the muscle in your arch. So how you do that is you're going to grab a band, cross your leg over, point your toes down, and raise your toes up towards the ceiling. And that's going to help strengthen that muscle up there. And nice and slow. So when you do any of these exercises, I want you to go nice and slow and easy, and long holds of at least 3 seconds. 1, 2, 3, and relax. Going down, nice and easy. Going up, we call that concentric contraction, meaning the muscle is shortening. And then we have eccentric contraction. That's where the muscle is lengthening. So that's going to give you the strength, is actually that eccentric motion. So if you go nice and fast like that, that's not going to do anything. In fact, that might actually cause pain. So you want to go nice and slow with that. So that's one way to do that. So another way is doing some stability exercises with a resisted band. And so you can do, we'll say it's my right ankle that's having the issue, and you can put a band around your ankles like this right here and stand on one leg. So this is the strong leg here, and you can also put, if you have foam or something like that, you can stand on the foam. That's going to help with improved stability with your ankle there. So what you're going to do is going to tap the foam and come back. Tap the foam and come back. And you can bring the pad in a different direction. Tap and come back. Tap and come back. You can feel your ankle just kind of really stable. Also, we're helping out with the hip too. That's going to help strengthen the hip, and that's a very important thing to do too. So the standing leg, we're working not just the ankle, but also the hip abductors, the side muscle of your hips there. So again, you can come out and touch. Come out and touch, and then you can come back into a back position here. Come back, touch, come back, and touch. So that's one way you can do. You can do repetitions, set a timer, and do that for a minute or two. I would do that almost on daily with that exercise, because that's going to help you improve your stability. Again, we're runners, we're going to be on our one leg all the time, and so you need that stability with your ankle, with your knee, and your hip. Okay, the next exercise you're going to do, you're going to put a exercise band around your feet, and then while sitting, you're going to step to the side and to one side, for example, to the left, come back to the center, come back to the right. You can do that for several repetitions. You can go up to at least 20 repetitions, maybe even up to 30 to help improve the side portion of your calf muscles. We call that the pronoid muscles. They'll help keep you stable on the outside portion of your ankles there. So it's very important there. So pretty much what we're trying to do is trying to keep you stable around the inside part of your ankle as well as the outside part of the ankle. Give you stability as well as on the bottom portion of your ankle. Again, like I said, what happens is you normally do pronate when you first take a step to help absorb shock. And then when you push off, you should have a good arch support, and that push off creates a rigid lever, so that way your knee does not go in compared to whenever it does, it continues to go out. You can almost see that knee going out there. And so that's what we're trying to prevent, is that inside position of your knee. So that what happens is that rotates at the hip inside and also up to the pelvis, all the way up to the head and neck. And that can create some problems for individuals with running or even walking. So some people that are significantly weak on their hip can have issues even with walking. Now definitely as runners, we need pretty good stability in those hips in order to keep our pelvis nice and even, keeping while running, because we're having a lot of ground reaction forces causing some pressure up the chain. So we need that muscle support in order to keep that nice and stable. Well, that concludes this episode. So if you have any comments about ankle instability, please comment below. And if you haven't subscribed to this channel, please subscribe and ding that bell and hit the like button as well. And hope everyone keeps safe, keep running, and we'll see you next time.